Okay, well, thank you everybody for joining today's session about how the heart works. It's April the 21st, 2021. My name is Paul O. I'm the medical director in the program, and this session is one in the series of Cardiac College Online devoted to expanding our shared understanding of heart health topics. A reminder that these sessions are really being provided for education as the prime purpose. You may have some very specific questions about your own health situation, and ideally, it'd be great to connect in with your own healthcare provider about that. However, we will be very interested in fielding questions from the group, and I'll do my best to answer them. Sometimes they may be from a more general perspective as opposed to specific. And if you want to ask a question, then please enter your question into the Q&A function of the Zoom platform. By the end of this session, we hope to achieve these objectives that you will know how a healthy heart works, going through the major systems that comprise a healthy heart, including blood supply, an electrical system, the valves, the heart muscle and pump function. We'll segue into issues that speak to what can go wrong with the systems in these hearts, and describe interventions that try to correct some of these problems along the way. And hopefully some questions will accumulate as we touch upon the area that might be of greatest relevance to your situation. Let's start with the question of what does the heart do? The heart is a muscle that's about the size of your fist. It's located in the middle to left side of your chest. It is a muscle that primarily has the function of pumping blood. And with each contraction of the heart muscle, it sends a heartbeats full of blood, oxygen-rich blood around the body to exercising muscles so that, and other vital organs so that oxygen is delivered and can feed all those metabolic systems. The heart is the muscle that is comprised of four main chambers, two atria on the right side and the left side, two ventricles on the right side and the left side, valves that separate the chambers, the atria and ventricles, as well as the ventricles from their major blood vessel. The right ventricle pumps to the pulmonary artery through the pulmonic valve. The left ventricle pumps to the aorta through the aortic valve. These major blood vessels will carry blood to and from the heart. So a lovely connected system. And some of you may have had surgical interventions around any of these aspects. As we said, for the heart to function as a well-coordinated system, it requires its major functional systems to be in operations. And we might think of the heart like a house in terms of how it's built with, walls and plumbing and electrical systems and doors and windows and a roof. And if all that's going well, the heart is very much intact. It can house people comfortably. It will withstand the elements, etc. Well, within the heart, it has a very similar kind of construct with a blood supply to the heart muscle itself. And think of this like the plumbing to the heart. And often we see people in cardiac rehabilitation programs who've experienced an issue with blood supply. There's also, though, an electrical system where the cells in the heart are all potentially electrically active. There is a normal electrical system that kind of follows the route of like the main junction box and wiring that travels through the house through major electrical cables. And the heart is wired in that way as well. Could be good. There are also challenges that will potentially come up, and we'll talk about those things. The valves, think about those like the doors and the windows in your house. When they open and close beautifully, they separate your rooms and maybe create some soundproofing and protection of blood of airflow and temperature. When they go wrong, there's leaking, there's sticking, there's squeaking, and these things can happen to our valves as well. And these systems work in coordination with creating a marvelous pump that beats tens of thousands of times every day and keeps that blood flowing throughout our body. And when it works well, it's fantastic. But you know, when we've got systems that get older, that get affected over time, then there are these opportunities for conditions to go off the rails. And that's what we mean by various kinds of heart disease. Sometimes we use heart disease as a very specific thing that might refer to diseases of the plumbing, but kind of more broadly, heart disease can be an umbrella term for all the conditions that can affect those various systems of our heart. So when there's a plumbing problem, we might more specifically refer to this as a coronary artery disease issue. When there is an electrical problem, we may lump that under the term of arrhythmia, which is more of a descriptive term, a meaning bad, and rhythm, I think we recognize that as the cadence and pace of our hearts. But there are a number of electrical heart diseases that may arise. We may have problems with the structural integrity of our valves, those doors and windows, and develop valvular heart disease. And then finally, diseases of the heart muscle are referred to as cardiomyopathies, which is really the Latin term for cardio meaning heart, myo referring to muscle, and pathies being diseases. And those can take various forms as well. So let's go through some of these issues in turn. The coronary artery disease represents a buildup of plaques or atherosclerosis, arterial sclerosis, various kinds of terms to represent or to describe this this figure that's shown in the middle part of the slide, that if we look at the different arteries that feed the blood vessels or that are the blood vessels that feed oxygen-rich blood to our heart muscle, we've got vessels that are on the right side, some on the left side, some twisting around the side. There are many tributaries like this, like a complex river system. And sometimes we key in on the major ones, the right coronary artery, the left main artery, the left anterior descending artery down the front of the heart, and the circumflex and others that go around the side of the heart. Inside each of these arteries, there may be propensity to develop problems over time. Ideally, this is what a nice healthy artery looks like in cross section, that it is a wide open tube with a smooth lining, and all the blood cells representing blood flow will transit through there unimpeded. But we know that, you know, very commonly in North American society, even at a very early age, like our 20s and 30s, we may start developing very early signs of plaque, atherosclerosis, arterial sclerosis. Again, terms representing the same sort of phenomenon, where there may be buildup of fatty cholesterol, LDL materials combined with certain kinds of cellular makeup in foam cells and macrophages to then build up more of this atherosclerotic plaque. Over the next series of decades, we may have a larger growth of this plaque over time. Sometime it grows enough to cause limitation of flow, and we may experience then the consequences, the symptoms of blood flow limitation, like chest discomfort and angina, or sometimes there may be an acute event occurring in the setting of that atherosclerotic buildup with a rupture and then inciting an acute thrombus and blockage of blood flow. That's what a heart attack or myocardial infarction might be. So there is coronary artery disease that develops over very many years. It may manifest in different ways, from no symptoms at all through to angina, through to development of an acute coronary syndrome with chest pain and heart attack. The signs of coronary disease, as we've described, if there is limitation of blood flow that's predictable and provoked by exercise or cold, that's the hallmark of angina. If there is an abrupt reduction in blood flow, then we may develop angina at rest. This is called unstable angina, signifying that there is an acute in the moment coronary syndrome going on. In classical representation, this is described as pain, heaviness, discomfort in the middle to left side of the chest. Occasionally, it will radiate in other places. That is, it seems to be traveling down the arm or the neck or felt that way because the pain signals from the heart may not be localized just to the heart. It may share some nerve kind of territory with this whole area here. In subtle cases, some people may only feel discomfort in the arm or in the back. And in even more subtle cases, people don't experience discomfort at all, but rather it may be perceived as shortness of breath or fatigue or something else. So we need to have a kind of high level of suspicion for persons with known coronary artery disease when new symptoms derive. When acutely things go off the tracks, this is what we mean with the heart attack kind of example. So this is an example of a coronary plaque that's blown up for us to visualize. For orientation, this large pink crescent moon represents that atheromatous plaque, the arterial sclerosis that's built up over years and years and years. What's happened here pathologically is that there's been a rupture in that plaque that has then incited the formation of this red oval-shaped structure in the middle. That's a thrombus. That's a blood clot that doesn't belong there. And then furthermore, the problem with this kind of artery is that it is rather dysfunctional. The lining cells called endothelium may not be as healthy as they should be. They may be stiff. They don't open up properly. They may be more prone to developing things sticking to them. So this is the setting where bad things will happen, and when a plaque particularly goes bad. There are a number of approaches to helping with these problems of the coronary arteries. And given that you're enrolled in a rehabilitation program, we hope that over the course of the many weeks or few months of your program that we'll touch upon all of these particular areas of approaching quotation mark lifestyle or health behaviors in a very positive manner. Through sessions like this, we hope that you'll gain a greater understanding of your own condition and approaches to kind of managing the condition through medical approaches. But then equally as important, gain an appreciation and get activated to engage in the healthy behaviors that we know are very complementary to the things that we've experienced from a medical perspective. So getting active on a regular basis, eating healthy, feeling well, looking at stressors, psychosocial health, relationships are all critically important, that all feed into ultimately in the middle here, taking control of one's health. We consider these the 5 program pillars of rehabilitation that impact on all aspects of heart disease management. When it comes to management of the medical side of coronary artery disease, in another session, we will talk about medications and how these various medicines that comprise the typical cocktail of drugs that you are taking, maybe not the fun kind of cocktail that you might be used to, but this is the medication cocktail that commonly includes medicine like aspirin to deal with the thrombus, beta blocker drugs to deal with the overall heart function and beating, statin and other kinds of cholesterol reducing medications to deal with this large cholesterol buildup, and then medicines like the ACE inhibitors and the angiotensin receptor blockers that can work on that lining cell and the blood pressure and regulation and relaxation of blood vessels that is also important. So again, we'll spend a whole other session about medications, but just highlighting that they are part of this story as well in terms of how we might approach this. We want to spend a few minutes in this particular session talking about the other approaches that deal with how the heart works when it's right and how the heart works when it's not right, and things that we can do to try to restore the balance. So some of us would have undergone procedures like percutaneous coronary interventions. Another term for that is an angioplasty, referring to the notion that One may have a catheter thread up through the artery in the arm or artery from the groin. It is passed along and passed all the way up to the heart until it reaches one of those blood vessels where there is a blockage. And if we look down here at the left anterior descending artery, if we imagine that there was a segment of artery that was narrowed here, we'll pass the wire all the way up from the blood vessel in the arm or the leg, all the way up backwards through the major blood vessel, the aorta, and then down the left main artery, down the left anterior descending artery to the point of narrowing or blockage. If you want to see a nice animation of this, then you might link into the American Heart Association Interactive Cardiovascular Library, where they can show a nice cartoon of how a wire and balloon will be passed up at the time to the point of the blockage. The balloon gets inflated to squash that blockage against the walls. And then to keep it open, there is passage of another balloon with a metal strut or stenting system to keep that artery nice and open. Think of this like the spring on a click pen that can be placed into the artery to keep things propped open very, very nicely. And this more stylized illustration shows the artery in long section, the atherosclerotic plaque that is shown here as this ovoid yellowish kind of substance with lots of other kind of cellular and other fibrous tissue that makes this up. The balloon has been inflated, the stent has been expanded, and then when the balloon and wire are removed, the stent remains behind to keep the blood flowing. So that's a very nice approach that many people have gone through, percutaneous coronary interventions, and it is offered very widely at the time of heart attacks or when other blockages are discovered. Another tried and true approach to dealing with blockages, especially when there's a whole bunch of them in the heart, would be to do some sort of bypass past that area of blockage. So here, in this cartoon of the heart, we're focusing in on the right-sided artery of the heart, the right coronary artery, and we're imagining that there might be a blockage in this area that's shown in the darker black color, an area of blocked artery where there's poor blood flow. And perhaps because of the anatomic considerations here, perhaps because there may be other areas of blockage, the heart team and you have decided that a bypass operation might be the best way to deal with this. And in this case, a vein is taken probably from the person's leg. A small segment of that vein, the nicest, most open tube, is taken out and measured appropriately to go from the root of the aorta down to a segment of the right coronary artery where there's good flow past that. So this section is actually not touched at all. We're just creating a new bypass route, much like we might build a new road around an area where there's very poor traffic flow or something like that. This kind of brighter illustration shows, again, that right coronary artery bypass using a saphenous vein. And then in recent years, there's been a real movement to use native arteries that have kind of a nicer structure to them and perhaps greater longevity to them. And then this artery from the inside of the chest wall, the internal mammary artery, is often the one that is used for bypass that goes into the left anterior descending artery. So you can see here that it doesn't need to be inserted into the main arterial tree. You only need to remove the lower section from the inside of the chest wall and then insert that into the heart. Good news is that there are other blood vessels that feed the inside of the chest, so we can use this one as a bypass. So these are nice examples of coronary artery bypasses that might happen. That's section one around the plumbing problems that can happen, coronary artery disease. What's going on with our electrical systems? Let's turn to the electrical cables that make up our heart. So once again, if we look inside of our house, we can go to our basement or the closet in the condo and find where the fuse box is and where the big electrical wire came from outside from the main junction. Well, that's kind of the representation of the electrical flow inside of our heart. Consider this your main fuse box up in the right upper part of your heart, the sinoatrial node. From there, the major heart impulses are generated. They travel along small pathways in the upper chamber of the heart, go through a junction here called the atrial ventricular node, the place between the atrium and the ventricle. It then passes down major electrical cables. Think of this as, the bundle of cables headed for the bedroom and the kitchen and the dining room, for instance, and then they split off to go to each of those rooms separately on the left side of the heart and the right side of the heart. So this is a lovely system where there's electricity generated all the time. But imagine, and some of you don't even have to imagine this, you may have lived the experience that if your house is 50 or 60 or 70 years old, and you look at the wiring that might be in the walls, some of it may be in good shape, but not surprisingly, some people may have problems with their electrical wiring, whether it's old systems with knob and tube wiring, I think I've got that right, or maybe you've had a nest of squirrels get into your walls that might have been chewing on some of this stuff, or maybe the insulation has just kind of broken down over time. These are the same kinds of issues that may affect our electrical systems in our body. We will go through at another time a longer session about irregularities of the heartbeats and what we might do about them. Briefly, here are the main things that may go awry with the electrical system. As for some people, it goes too slow. No surprise. For other people, it goes too fast. That we think of this as the slow ones where the electrical system is just wearing out over time. The fast ones are where you start to get things kind of firing off irregularly. There's too much excitement and too much stress in the heart, and there's so many heartbeats that go off. There may be actual breaks in the electrical cable. Think of that, scarring, other things that can happen that create blocks in the electrical flow. Atrial fibrillation is a specific kind of fast heartbeat that affects a lot of our population, especially as we get older and past the age of 60 or 70. 5 to 10% of the population may be living with this condition called atrial fibrillation, which is irregular and fast and prone to producing blood clots in the heart. And then many people develop irregularity of the heartbeats. We may colloquially call them skip beats. Those are sort of benign, but if we skip a whole lot or have a lot of unusual irregularity in the heartbeat, that may be a sign of danger to come, and we may need very specific interventions to help with that. Some of the things that we can do, if the heartbeat goes really slow because of our electrical systems wearing out over time, well, it's possible to take over some of that function with a pacemaker. This illustration of what a pacemaker might be shows us that the pacemaker guts itself is a small device. I used to say it's about the size of a cigarette lighter, but nobody knows what a cigarette lighter is anymore. But suffice to say that it's about 4 centimeters by 3 centimeters. It is placed under the skin and fat tissue in the upper chest, usually under the collarbone. It is usually on the left side. Sometimes it can be on the right side. And modern days, they can be placed elsewhere. The guts of the pacemaker consist of a battery that lasts for many years and a mini computer that its main job is to read the electrical signals coming out of the heart. And it reads if they're going on at a reasonable pace or if they're going too slow. The way that it reads it is by this system of an electrical wire that is passed along through the blood vessel underneath the collarbone down to the heart. And often there is one of these electrical wires, and sometimes there's 2 electrical wires that is placed to the heart, so we can read the electrical signals. These wires are also called leads, which detect the electrocardiogram signal. If the signal that is fed back to the computer is deemed to be too slow, the computer can very rapidly fire down a new signal to trigger a heartbeat. And this is what happens with pacemakers. This is an electrical cardiogram tracing of the heart for a person in whom the electrical pacemaker is actually driving all of the beats. And you can see that each of these deflections denotes a heartbeat. The little sharp spike that is denoted with the red arrow denotes a pacing spike that comes out of the pacemaker. So it is the pacemaker that is telling the heart to discharge electrically and create a heartbeat. So lovely how these things can take over. For other people with fast and irregular and dangerous kinds of heartbeat, there are souped up computer systems that can be implanted into the heart, a very similar sort of system with a computer battery and wires that go down to the heart. But this is a smarter computer that is called a Cardioverter defibrillator that reads these electrical signals. And if the signals are very wide and fast and unusual looking, you can see that this is not terribly organized in comparison to the electrical signals on the right-hand side, which have this very nice, smooth, predictable pattern with a small beat, big beat reset, small beat, big beat reset. This is called P wave QRST, P wave QRST. This is very normal heart rhythm called sinus rhythm. This is a sharp contrast to this stuff over here that is wide and disorganized and way too fast. This is an example of ventricular tachycardia or ventricular fibrillation, dangerous heartbeat that is leading to the heart stopping. If the computer reads that that's going on in the heart, it will deliver a very strong shock all at once, a defibrillation shock that comes out of this little computer to reset everything. So this is a smart way of dealing with irregularities of the electrical system. Moving forward, that if we've got anatomic problems of our heart valves, we've said that we've got 4 chambers of the heart, 4 different heart valves in these different positions, tricuspid, pulmonic on the right side of the heart, mitral and aortic on the left side of the heart. Normally, when the valves are seated very nicely and they fit together, just like the brand new door opens and closes in the door jamb beautifully with no sticking, that everything is working well, that when the door is closed, when the valve is closed, blood is building up in the atrium. When the valve or the door opens, blood flows into the ventricle, and there's a nice system of blood flowing through the heart. There are various problems, however, that can happen with these various heart valves. And in this case, we can show with the aortic valve as an example, that this is what it looks like normally when it's open, nice and wide open, like a fish mouth or a bird beak. And when it's closed, all of the valve leaflets come very close together and there's no leaking. It's like a Mercedes signal, or Mercedes symbol, isn't it? This kind of the tri-leaflet sort of thing. For some people, either because of something that we're born with or wear and tear over time, it is possible for the leaflets to get damaged and thickened over time. And when that happens, then the valve will not open up fully. It's like your door is sticking and it just won't go all the way. So that there is restriction of blood flow as a result in the open position. And in the closed position, it looks really ratty and jammed together. So it doesn't really move particularly well. This is called stenosis of the valve, or a restriction of blood flow. On the other hand, some people develop valve problems where the leaflets become leaky. They don't come together very nicely. Think of it as the old window that's been there for 20 or 30 years, and it's winter time and the wind is howling. You can feel and hear the wind coming through because the window doesn't really go down into the jamb properly. Well, that can happen with heart valves as well. And when blood flows in the wrong direction, it can cause excess stress on the heart. It can cause stretching of the heart and lead to other problems with blood flow. So when these situations happen, fortunately, there are procedural approaches to fix these valves. in the right hand, sometimes we can just repair these valves so that they come together more nicely. But sometimes, like if there's a terribly restricted valve like this, it may actually need to be replaced completely. The classical approach to fixing a valve that is way too sticky or stenosed is to actually remove it and replace it. This stepwise illustration takes us from the point of an open heart surgical approach, where in step number 1, there is an incision made on the chest wall right in the middle. The sternal bone is opened up, and then the heart is exposed. There is a cut that is made right here at the base of the aorta to expose that aortic valve that is shown in number 3. In number 4, up here, we can see that the surgeon is making a cut around the edge of the valve to remove it completely. And then in step number 5, once that valve is removed completely, a new valve is being sewn into place and being positioned right into that ring of where that valve sat previously. And then everything is tightened up with the valve, everything is closed up with the blood, the aorta blood vessel, and then the heart is closed, the chest is closed, the bones are brought all together, and then that would be a really skillful surgical aortic valve replacement. So this is a great operation to fix a stuck valve. It requires this larger open surgery, however, so that there is some recovery time that is needed. There are various kinds of valves that can be put into here. Some of them are made out of tissue, some of them made out of metal or other kinds of artificial sorts of materials. A somewhat newer approach to fixing a valve that is kind of stuck and not opening particularly well is to take a catheter-based approach. So we talked about catheters that may be used at the time of percutaneous coronary interventions to open up of narrowed coronary arteries. Well, now we're talking about passing a larger wire up through the groin into the blood vessel in the groin, up towards the heart. And then once it reaches this valve, a new balloon and new valve can be placed right within the old stuck valve, and then it is all just inflated in place. So there is no longer a need to make a big cut into the chest and opening things up. Instead, this valve can be placed through the catheter technique, and there is basically a puncture that is made in the groin. So these kinds of transcatheter aortic valve implants or replacements are being done more and more to do these valve replacements for people without the need for the larger surgery. Finally, moving on to the pump problems or the muscle problems, we've previously described these as cardiomyopathies. And this illustration contrasts for us what a normal heart structure and shape might look like. And if we pay in particular attention to this left ventricle that is meant to be a nice, sleek, efficient pump that's kind of doing its job all the time with these walls coming in nicely. What is shown here, and I think you can appreciate the contrast here with this left ventricle, that it is really stretched out, it is dilated or big or expanded. The amount of blood that's sitting in this heart is 2 or 3 times larger than it was before. And the muscle wall of this heart before was somewhat thicker and strong. Here it's thinned out and weaker. So we've got a big baggy heart now instead of a nice, sleek, strong, muscular kind of heart. So the term for this is a dilated problem of the heart, a dilated cardiomyopathy. The clinical syndrome that that folks may have heard of is heart failure, meaning that the heart is failing to meet the pumping demands that it used to do, it is manifest with people feeling short of breath and tired, and perhaps developing fluid congestion from the heart back to the lungs. There are a number of approaches to what can be done if the heart is affected in this way. And once again, there are medicines that can help with this, such as the beta blocker drugs that can help slow down and relax the heart to allow better coordination, medicines that can reduce the stress and strain on blood vessels, the ACE inhibitors and the angiotensin receptor blockers. We've talked about all of these before, and we'll dive into them much further in our medication section. And some people may be taking diuretics or water pills to reduce some of the excess salt and water in the system. Way down the cascade, just kind of rounding out things that might be put into play with procedural approaches. If the heart function becomes so advancedly compromised that there are approaches from the procedural end of actually putting in an external pump and inserting that into the tip of the heart, and then it will provide pumping action inside the heart where the heart muscle can't do it. It'll pull blood out past this tube into the main pumping chamber. So this is a device called a left ventricular assist device. And then, the ultimate surgery for heart is actually to remove the heart entirely and replace it with a transplanted organ. And, the University Health Network is one of the largest centers anywhere where these types of organ transplants are done. So amazing scientific accomplishments. So we have gone through in the last 35 minutes or so a description of systems within the heart that include the blood supply, the electrical system, the valves, and the muscle pumping. We've talked about kind of normal functions as well as abnormalities that may arise from these various areas. We've touched briefly upon medication approaches. We've emphasized the importance of lifestyle and rehabilitation in all of this, and described some of the procedural advances that can help remedy problems that can arise from any one of these systems as well. So we hope that we've achieved the objectives that were laid out in the beginning of knowing how a healthy heart will work and what can go wrong, and the interventions that may arise from this. At this point, we're inviting you in to offer up any questions that you might have. Okay, I don't see anything here. If there are questions that may arise afterwards, well, here's one. Where can we get more info on medicine? So let me show you in just 1 second. So I'm glad we've tweaked maybe some interest in what else we might offer in these sessions. So I will get to answer that in just one moment. But this slide is talking about Healthy University. So my first answer was going to be go to Healthy University, because at the web platform, and if you're clicking on Cardiac College, you can get through it through our social media, or you can get to it through the web platform. You'll find actually a whole chapter about the heart and how it works. You'll find a whole chapter about medicines as well. And then in an upcoming session, if you can wait, we'll do a live session together about your heart medicines. If you want to see something like now, there's a well-curated library of a similar sort of talk that we've done in the past around heart medicines, and you'd be welcome to view one or more of those sessions about medicines. And if there's something specific that you want to pose to your case manager, cardiac rehab supervisor, feel free to fire in that question during your weekly chats or by email. And if you want me to get involved, then they can certainly forward that question on to me as well. Hopefully that answered your question. All right. Well, I recognize the time and the pressures on everyone's schedule. I appreciate you joining in today for this session. We hope that you found it of some use. If you would like to continue on with the conversation through this format, then we'll invite you to join us next week for the next installment of Cardiac College Online. And on Tuesday, April the 27th, we'll be speaking specifically about diabetes medications, the various categories that one might be taking to help manage diabetes, but also the effect of these medicines on the heart as well. So stay tuned, tune back. And in the meanwhile, we hope that you'll stay well. Have a great day. It's been a pleasure being with you.